Good afternoon, ladies and gentlemen. QED, and I welcome all of you to join this special session. Let me start opening remarks by my video. Good afternoon, ladies and gentlemen. Welcome to High Intensity Focused Ultrasound Special Session. I would first thank President Akira for this special session, and I also let me share this session with my old friend Dr. QED. Would you let me first give a few words as an opening remark? Uterine fibroid treatment, less invasive to non-invasive. Uterine fibroids are the most common benign tumor of the uterus, affecting 25 to 30% of women worldwide. Surgical management of uterine fibroid has changed from laparotomy to minimally invasive surgery. Hysteroscopic myomectomy or transcervical resection (TCR) should be considered first-line conservative surgical therapy for management of symptomatic submucosal fibroid. Laparoscopic myomectomy has been the best treatment option for symptomatic women with uterine fibroid who wish to maintain or improve their fertility. In the era of non-invasive gynecological surgery, high-intensity focused ultrasound (Haifu) may be the treatment of choice, which offers non-invasive treatment of uterine fibroid to reserve the patient uterus and ablate the fibroid extracorporeally, preserving fertility. I would like to first show my encounter with Haifu. This shows APAGE in Chongqing, and I visited National Engineering Research Center of Ultrasound Medicine in Chongqing. Professor Rodi kindly showed the Haifu. In simulation room, I feel as if I am treating the patient. High station in 19th APAGE. Dr. Felix Wong and Dr. Kiwi Lee chaired the session. Felix is from Hong Kong and Kiwi Lee from Singapore. They are old friends of mine and advanced laparoscopists. They all say to me, it's time from less invasive to non-invasive. APAGE is now interested in Haifu, and most recently, August 26th, I chaired a session with Dr. Angela, as shown this slide. Yeah. Many doctors have shown the Haifu and treatment of myoma and adenomyosis. After this Congress, we will have another meeting, October 28th. Haifu series webinar episode 3 is scheduled. So save the data also this one. And now we are going to start the session. Okay, will you please let me introduce co-chair Dr. Kiwi Lee. Kiwi Lee is an old friend of mine. Yes. And he had a special interest in the provision of pregnancy care and delivery services, and president of Obstetrical and Gynecological Society of Singapore from 2003 to 2005. And he very excellent laparoscopist and founding member of the Asia Pacific Association of Gynecological Endoscopists, APAGE. And he has introduced high-intensity focused ultrasound, Haifu, a non-invasive surgical procedure for the treatment of uterine fibroid and adenomyosis, and became one of the pioneer gynecologists to perform Haifu in Singapore. So will you start your remark, Dr. QED, please?
Thank you. Thank you, Professor Osamu. I must congratulate you because you just been about the lifetime achievement was my effect because of the contribution. Now, this second is mainly on Haifu. Haifu, which is a subject by effect, is a Haifu that to us is the most advanced in the world right now for gynecology. So we're talking about Haifu using the Chongqing scanner machine, and this is ultrasound guide very suitable for gynecology. It has no cut, no incision, very different. Very patients, very first shot. It can be done as day surgery and last need of hospitalization. So that it can save money for other patients, especially in the current COVID pandemic, where hospital beds are so short and in demand. You can still do Haifu as day surgery without the need to have blood transfusion. Furthermore, once you have the Haifu machine, you can do Haifu even in your clinical practice without the MRI. You just need the MRI image. So you do not need to occupy the Haifu, the MRI machine, which is used by the radiologists. And Haifu is sound and no radiation. The very safe for us. At the present moment, we have a lot of surgeries for fibroids and adenomyosis. The complications, whether it's done by open method or MIs, will be hemorrhage leading to conversion to hysterectomy, adhesion formation, and uterine rupture when the patient is pregnant. So to me, as a gynecologist, from over surgery to MRs, not to no incision is very critical. But you satisfied as a doctor, I urge all of you, especially in Asia, to champion hospital adult so that we can influence the West to the hospital. Because all along we learned robotic surgery and laser from the West. This is the time for Asia to stand up and compare Haifu and share with the West. Thank you for your attention. Over to you, gentlemen.
Thank you for opening remark, Kiwi. He is quickly recovering from his surgery. Okay. Next speaker, Professor David Granstone. His topics will be ultrasound guided Haifu application in Oxford. Professor David Granstone is the president of International Society of Minimally Invasive and Virtual Surgery, and also chairman of exclusive committee of the Oxford Center for Mission Studies, and clinical director of high intensity focused ultrasound unit in Oxford. So now he's going to give us lecture. His title is Ultrasound Guided Haifu Application in Oxford. Please start.
Well, it is a great pleasure to be able to share with you today our experience of high intensity focused ultrasound in Oxford over the last 20 years. And it is always much better to come in person, but with our current problems with COVID, of course, that is not possible, or hopefully I will be able to see many of you in the near future. Many of you may have been to Oxford, but if not, you would be very welcome to come at any time, and I would enjoy showing you around. So here are the machines that we have. This is the first building that we had in the West for Haifu machine. We had the JC200. Now we have a new radiology cancer building, and we have a room in here where we have the JC200. And Haifu is wonderful. It follows the demands of William Hosler, who said diseases that harm require treatments that harm less. And also the ancient medics who said, first do no harm. We all know, I think, how ultrasound works. Normally we just look at the image, but of course with Haifu, if you put the power up 10,000 times, then you can destroy tissue. We have in Oxford a big preclinical division with Professor Konstantin Kusios. He is, you can search for him on the website, working in this building, and he has many very high-powered preclinical uses of Haifu. But clinically, we have treated a number of different organs, which I will talk about today. And we are currently looking at pancreas, hoping to look at breast, hoping to look at metastatic renal cancer, and further studies on primary renal cancer. And here are some of the experimental ones that Konstantin is involved with, and I will talk a little bit more about some of those. So we had the first machine from Chongqing in about 2002 and worked on liver and kidney, looking at the safety and toxicity of the treatment. And we had about 56 patients with livers and kidneys. Some had Haifu treatment and we looked at them radiologically. 7 had Haifu treatment and then they were resected and looked at histologically. Likewise with kidney, 7 surgical, 14 non-surgical. So we did have the histology on quite a few patients. Very few side effects, occasionally blisters on the skin. And this is the team that we worked with to start with. And this lady who had metastatic liver cancer was very kindly the first patient we ever treated. She was the first patient ever treated by Haifu, extracorporeal Haifu in the Western world. She died some weeks later. And this is the team that we had. David Wild, sadly no longer with us, he died, but the rest of the team are still alive and working on Haifu or other projects. And here we wrote up in the British Journal of Cancer the safety and feasibility of Haifu in a Western population. And as a result of that, got the European Community's approval for the Haifu machine back in June 2005. So I'm not sure if you can see the top of this, but this was some of the trials that we were doing. Extracorporeal, from 2004 to 2006, ablation of large renal masses, then histology, then small renal masses, and then a second trial with small renal masses. We had a little bit of work looking at laparoscopic, and then some translational work looking at acoustic properties of perinephric fat. And these were the 17 patients on renal patients that completed, 15 completed, 2 were abandoned, and a 6-month follow-up. 1 had surgery. The ones that were abandoned, 1 had intervening bowel, which we couldn't remove. But 10 remained under surveillance and some had further surgery. And here is an example of a small renal tumor with some uptake, which I think you can see there, a little bit of white. And here it is 12 days later, no uptake. And again, if you look at 6 months later, 1 year later, and even 5 years later, successful ablation of this small renal tumor with no recurrence and no uptake. Of course, laparoscopic Haifu is not non-invasive, it is invasive, but we did look at a patient with Haifu laparoscopically and then removed the tumor, and you can see that the laparoscopic treatment had a lot of ablative area there. But we stopped doing this because actually the purpose of Haifu, we feel, is that it is non-invasive, so there's not much point, we felt, in doing laparoscopic Haifu. I don't know if you can see this, ultrasonic properties of fat. There are 2 problems with treating the kidney. One is the ribs, which can get in the way, and the second is there's a lot of fat around the kidney, and this dark area here is fat around the kidney, and that takes away some of the Haifu treatment. So what we did was we took 10 patients who were undergoing renal cancer surgery, and we took perinephric fat from them, and we looked at this in a bath, in a saline bath, and put fat through transducers. And here you can see basically the thickness of the fat and the decrease in output of Haifu. So with 5 centimeters of fat, you only have 1/4 of the intensity. And so we were finding with the kidneys that quite often it was the fat that was ablated and the kidney was not touched. Now, you may or may not know that with a renal transplant, you take the fat off and you put the transplant in the groin. So there's no ribs in the way and there's no fat. And here is a transplant with a tumor in. We treated it with Haifu and found that we got virtually total ablation. I did then take this out, and there was a slight small rim of tissue which was still viable, but 90% had been ablated. Of course, many of you are familiar, of course, with fibroids and the treatment of fibroids. And Haifu is excellent for fibroids. Here's a patient with uptake here. And here, 2 weeks after Haifu, no uptake here. 2 years, a little bit perhaps more around the periphery, but nothing inside. And of course, with Haifu, unlike radiology, you can retreat indeed as many times as you want. And the China 20 center study was a landmark study which we helped to write up. We didn't have any participation in the treatment in this cases, but we helped to write this paper up. 2,400 women with symptomatic fibroids. And we looked, or you looked, the Chinese looked at complications, hospital stay, and the need for further treatment. 1,353 had Haifu, 472 hysterectomy, 586 myomectomy. Very, very few side effects with Haifu. The hospital stay, many of you who will be using Haifu know that you can do it as a day case under sedation. Many of the China patients came from a long way away, which is why they were staying for 4 days, but still less than hysterectomy or myomectomy. And as a result of this landmark study in China, it was written up in the British Journal of Obstetrics and Gynecology in 2017. And we had a much smaller study in Oxford with just 12 patients. We've treated more than that now, but looking at a 2-year follow-up period and fibroid volume reduction rate, which was again positive. And as a result, primarily of the Chinese study, but also of our study, NICE, the National Institute for Clinical Excellence in the UK, recognized ultrasound guided Haifu for uterine fibroid treatment in 2019. I'm a urological surgeon. Prostate Haifu has been done for some years. I'm sorry about this unpleasant side, but it is transrectal, and an increasing number of studies show that the effects are as good as other localized treatment for prostate cancer. Prostate cancer is a slow-growing disease, and it's been shown that to treat it and to show a difference in mortality, you need to look out at about 15 years. But the side effects are less than in many studies. This is neurosurgical treatment for sacral chordoma. And this was a patient who had trouble sitting down. It's not malignant as such, but it's locally infiltrated and a very unpleasant tumor. And here is somebody who had pain, difficulty sitting down. We treated one side, we treated the other side. Here, both sides have now been treated, and the pain disappeared, and the patient was able to sit and have a much better quality of life. This was written up in the Journal of Neurosurgery in 2017. Targeted drug delivery. My colleague Konstantin Kousios and Paul Lyon were involved in this. Paul Lyon did this as his PhD thesis. And this is basically hypothermia by heating up a tumor in the liver to 42 degrees centigrade. So it's not ablation, but if you take a liposome, which basically has the consistency of butter, and you put doxorubicin, cytotoxic agents, into the middle, then at 37 degrees centigrade, this is stable, but at 42 degrees centigrade, like butter, this breaks open and releases the targeted drug delivery. So basically, you get a much higher dose in the area that you've heated up. And we were looking at primary and secondary endpoints at the concentration and also the effect on treatment. So basically, we were taking a biopsy of the tumor. We were then injecting peripherally into the vein thermodox and then heating up this tumor. And then as the liposomes pass through, they break open. And we get here 2 to 9-fold increase in doxorubicin in 6 to 9 of the 9 patients in the area. And here you can see, here's secondaries in the liver on a PET scan. Here's an area that's been targeted and there is no uptake there. And here again, the area that's been targeted, and you get this very high concentration of cytotoxic drugs in this point. And out of 9 patients with complete radiological assessment, they had, most of them had good results with the treatment, and further 2 developed some recurrence in the tumor. But this was written up in the Lancet Oncology in 2018, and it was the first in-man study where this had been done, the safety and feasibility of ultrasound-triggered targeted drug delivery of doxorubicin in liver tumors. And we are now looking at pancreas, both as targeted drug delivery in the same way as liver, and also in ablation. And Professor Wu, who is with us, been with us for many years, but he looked at 8 patients with unresectable pancreatic cancer and found that pain relief happened in all 100%. And these patients eventually did die, but they had pain relief when even opioids were unable to control their pain. And here, if you can see it, there is some uptake in this pancreatic tumor and no uptake here. So we are looking at that now, as I say, both with ablation and targeted drug delivery in trials. I don't know if you know this saying, which is Theodore Roosevelt, the American president, which it's not the critic who counts, nor the man who points out how the strong man stumbles, or where the doer of deeds could have done better. The credit belongs to the man who is actually in the arena, who errs, who comes short again and again, because there is no effort without error and shortcoming, but who does actually strive to do the deeds, who knows great enthusiasms, the great devotions, who spends himself in a worthy cause, who at the best knows in the end the triumph of high achievement, and who at the worst, if he fails, at least fails while daring greatly, so that his place shall never be with those cold and timid souls who know neither victory nor defeat. I think that's very appropriate for all those who are engaged in innovative research, especially Haifu. I certainly know of the criticism of people who say it's not going to work, why are you spending your time doing it? But I think it's a person who is working, who is researching, who is trying to press forward the bounds of knowledge, that is the one who is in the arena, who is working hard. So we have had a fantastic time. We have ongoing time over many years to come, I hope, with Haifu, but we have a great team in Oxford, supported by various charities, of course, by Chongqing Haifu, the Institute of Cancer Research, so preclinical and clinical work. And I'm grateful to all these people and many others now who are not mentioned here, who have made Oxford a great success. Thank you very much indeed.
Oh, thank you, David. We are really indebted to David for his work in Oxford. Next speaker is Professor Flickwan. I know Flickwan. She's the editor of APAGE, nearly 20 years. He's a great teacher and academician from editors in Australia. Then he moved back to Hong Kong and China, and he has many contributions to medical education in areas of civic oil, and here's many about it's the angels my medical science and medical technology channel. The whole human bless about the reverse committee of whole human city is a medical ambassador and the culture and the of science, medication, and many others. What is interesting is Felix has a new Haifu machine from Samsung, and he is the first one to operate out of a medical center. Some first time I hear somebody operating out of a medical center. Apart from French and Korea, he's got a beautiful setup. And over to you, Felix.
Thank you, Chairman. Thank you for the invitation to this lecture section, which specified the high-intensity focused ultrasound, the era of non-invasive gynae surgery. I'm going to share my experience from minimally invasive to non-invasive surgery for the management of my patients. Like many others, our training started with open surgery. Then impressed with the minimally invasive surgery, now many of us become minimally invasive surgeon. We started with diagnostic laparoscopy and the laparoscopic tubal sterilization. My minimally invasive surgery developed quickly when I moved to Australia in 1993, working at Liverpool Hospital. And I have the chance to develop the minimally invasive training center, promoting and training doctors in minimally invasive surgery. I started my laparoscopic surgery with a conventional 4-port laparoscopic surgery. Over the years, my laparoscopic surgery approach have changed to a modified 3-port hidden scar surgical approach, which have been published in the journal. Now, 95% of my laparoscopic surgery are using this approach. I use a 5mm laparoscope at the umbilicus and using it to introduce the second port at the left lower quadrant of the abdomen. And then the last port will be either a 5mm or 10mm trocar port at the umbilicus, just near the first umbilical port. They are separated by just a few millimeters. The 10mm port at the umbilicus can be used to remove specimen or to use for the moderation of fibroids. I also use nowadays various simple port device. For this device, I will use the single port laparoscopic surgery. It helped to produce wonderful result for my patient cosmetically. Not only I can remove, I can do many laparoscopic surgery with these two approach, and my patient all are happy, other than the in addition to their uncomplicated surgery. However, for the uterine fibroid, which have to use hysteroscopy, hysterectomy, and myomectomy, even though we have the abdominal approach, vaginal approach, and laparoscopic approach, however, despite our skill, problems still exist. We have patients with bleeding during surgery, after surgery, infection. They experience pain after surgery. It takes them a long time to recover. The healing takes at least 4 to 6 weeks, and worse still, they may have the organ removed. For the fibroids, sometimes the uterus are being removed. All this approach also depends on our skill. Complication, however, may occur because of the process of learning and practicing. Of course, even with the presence of another alternative approach, the robotic surgery, with the easy manipulation of the minimally invasive surgery approach, similar to the laparoscopic surgery, it has less bleeding, easy for us for suturing. It shows no hand tremor, and it's the top of the art in laparoscopic surgery, which is getting popularity and improving. The technique is improving, even single port robotic surgery. I am in a crossroad of whether to change to this approach or not. However, the expenses of the instrument and Da Vinci and also the disposable instrument, the investment is great. The training, and lastly, I think many of my patients do not need this alternative robotic surgery. Therefore, when there was an unusual opportunity and chances in year 2017, I met Professor Wang Jubel at one of the meetings in China. I learned from him his minimal non-invasive surgical approach. Now, he's the founder, or rather the inventor, of the focused ultrasound surgery. He is able to focus the ultrasound to a point where to drive the energy to heat up the target tissue up to 90 to 100 degrees. And you can see you can burn a plastic board. However, the hand in between the transducer and the target point is not affected. Now, I visit the Chongqing Haifu Medical Technology Company, which he founded to develop this minimally non-invasive surgery. And I also visit the company, the new site, and it's a well-established high-technology company with great potential to develop focused ultrasound surgery further. Then I visit many high-intensity focused ultrasound treatment centers in China. And also I visit Korea, Taiwan, and United Kingdom to see many of this development of this new surgical approach. This new surgical approach gives me the impression that not only is focused ultrasound able to destroy solid lesion, for example, a fibroid, which I'm talking about, and the patient doesn't need general anesthesia, doesn't need intubation, like minimally invasive surgery, doesn't require any sharp instrument that will cause bleeding. There's no bleeding at all. The best approach is that this surgery can allow us to keep the organ that is being treated. The patient can recover very quickly and can go home as a day-only surgery and can go back to work in a couple of days. And this the Haifu procedures that's being done in my Haifu center. The surgeon are just facing the computer console, and we are looking at the computer and identify under the ultrasound the fibroids, adenomyosis, and the nurses and the anesthetists can work in a small room, and then we can perform the surgery without much problem. No need for clean instrument and gun, and the room are present. The way how we do it is that we focus the ultrasound when we are able to see the fibroid. And sorry for the picture is not very clear, but the technique to do it is there's the target point where once we press the button, it will heat it up and the energy will deliver here. When we can see tissue necrosis, we can either see some grayscale change, or you can see the white patches, they're starting to appear. Now, we will burn point by point so that the whole layer of the fibroid are being burned. And then we move to the other layer from the side of it and starting until the whole fibroid or adenomyosis being treated. Now, I'm not going to talk about the effectiveness, the safety, and complication of focused ultrasound surgery, as this data can be available from the literature. Just easy to say, for the treatment of fibroid and adenomyosis, up to 80 to 95% effective, with minimal complication and much reduced major risk and low recurrent rate. And the theater, they're unlike those in the mind of our patient, the nurses, and the doctors. We don't need a theater full of instrument and operating table. And this the pictures where people are panicked by the time they enter into the theater for operation. Now, this is my theater in Hong Kong, which I set up the Haifu high intensity focused ultrasound surgery. You can see the environment is totally different. It's not like a traditional theater, and it's just a theater where it looks quite present. And the setting of it have been reported in the APAGE journal. Now, not only the wonderful present environment, during our surgery, the patient is fully awake. Some patients can even read their smartphone. And we also invite relatives, the mother of friend, to come to join them so that they won't feel too scared of the procedures. They can talk to the parent and talk to the mother or husband. So during the surgery. Now, in conventional surgery, which is quite different because patients go through a conventional surgery, fully unconscious, and when they wake up, they are full of pain. These are our experience with conventional open and laparoscopic surgery. Doctors perform the conventional surgery as a team, and there's also risk of infection. That's why we all with a septic gun, and we need a lot of helper, and that's the problem of the conventional surgery. The focused ultrasound surgery or non-invasive surgery is make a big conception changes of the surgery. Instead of group team of doctors, you just have experienced Haifu doctors and operating on the patient. Instead of patient put under general anesthesia, the patient can be awake to talk to the nurse. We don't need a big theater. We don't need so many instruments. We don't need a change room. We don't need the storage space or CSSD area. So it saves a lot of area for a theater and expenditure. And we don't need all this instrument and swab to count it before and after surgery, because the surgery just rely on a single machine. Therefore, the investment and the facility we can set up to provide this surgery actually reduce the cost for a patient, reduce the cost of each surgery. I compare the focused ultrasound surgery with the conventional surgery, and I report a paper that tells the surgery they are quite different. Focused ultrasound surgery do not induce any wound, and the uterus is conserved in focused ultrasound surgery, and the operating time is shorter. It doesn't require general anesthesia, and there's no blood loss compared to what we know from open surgery and laparoscopic surgery. And there's rarely any infection, and there's no adhesion formation or minimal adhesion formation. The patient recovery is very quick, less than 7 days, compared to 4 to 6 weeks in laparoscopic and open surgery. They take less sick leave, and the fertility can be conserved because the ovary is preserved. It does not affect the future pregnancy. Even normal delivery is okay for this group of patients treated with non-invasive Haifu surgery. Now, I also can share my experience that this focused ultrasound surgery is exceptionally good in certain circumstances. For example, I have a patient that's a young athlete, and she has heavy bleeding, so much so that she become anemic due to a recurrent fibroid, which a myomectomy already done many years ago. She was not allowed to take any hormone or painkiller, and due to the anti-doping association, the code, and which, however, she need to have the fibroid treated to recover from her anemia so that she can recover soon to meet competition. She received the Haifu ablation treatment for her fibroid. This is the fibroid before the operation, around 9 to 10 centimeter, and she recovered well after the surgery and able to meet the challenge of her spot. And this is the fibroid after 1 year, and is already reduced 70 to 80% in size. I got other patient. There's 2 patients, one with a large fibroid and the other with adenomyosis with severe bleeding. Both of them have severe bleeding, which they need to be treated. However, these 2 young patients have cerebral vascular accident with a cerebral stroke just a few months before the surgery. And after waiting for a year, and they still receive no surgical treatment because of the risk of recurring thrombosis. So I treat them with Haifu surgery, and they recover well, and they become asymptomatic after the treatment. They are uneventful. Also, for cases of adenomyosis, patients suffer a lot from dysmenorrhea and heavy bleeding due to adenomyosis. Many of these adenomyosis are diffuse. The only treatment we have is minimally invasive surgery to remove the uterus, and of course, to remove a large bulk of the uterine wall will weaken the patient's chance of a successful delivery. However, the treatment with Haifu will change the whole thing, because like this patient, after Haifu treatment, the uterus have much reduced in size, with the active adenomyosis lesion disappear. Her pain visual score have reduced from 9 to 0.5. She's very happy with the result. Now, another lady with adenomyosis in the uterus. However, she also has associated bladder endometriosis. We managed to treat her adenomyosis as well as the bladder endometriosis at the same time. Now after a year, she has much reduced symptoms due to her adenomyosis and bladder endometriosis. Now, not only that, ultrasound can have effect at the cellular level. It changes the nature of the cellular membrane. In this way, that facilitate drugs and nanoparticles to enter into the intracellular space during the ultrasound sonication. As a result, it's possible that nanoparticles with drug or no drugs are able to enter into any individual cells. With focused ultrasound surgery, it can produce more effective thermal burn and physical destruction of the cells. In this way, we believe research in this area can further enhance the Haifu surgery by reducing the ablation time, the use of powers, and the dosage of the nanoparticle can be adjusted so that it can be a more targeted treatment. Now, the other advantages of the Haifu non-invasive surgery development, from my opinion, that is a unique surgical approach. Because non-invasive focused surgery, ultrasound surgery, and its impact on the environmental climate change. Now, why do I say so? Because you can see the way we treat our patient, there's no medical waste, there's no blood loss, there's no instrument to be washed, and there's no contaminated swab. At the end of the day, the medical waste is much reduced. When all this medical waste are added together, it may impact on the environmental, and hopefully more use of this alternative surgical approach can make a difference for the medical waste from any hospital. Not only that, it reduces the risk, infection risk to the patient and the injury to the doctors and nurses, and all this can be reduced because the surgery does not involve any wound, does not involve any use of sharp instrument. Now, further research and further development in this high-intensity focused ultrasound area will further improve the safety and the effectiveness of the surgery, thus further reduce the complication of any surgery. The expansion of this Haifu surgery into the area of cancer, benign cysts, and other applications will greatly change the surgical scene in gynecology. So I foresee the change of surgery from now the advanced laparoscopic surgery to either robotic surgery or another direction for especially for the time being, fibroid and adenomyosis using focused ultrasound surgery. More development need to be done, and for extend the use of Haifu surgery into other areas in gynecology. For those who are interested in learning more about this focused ultrasound surgery in gynecology and in the treatment of adenomyosis, I've published 2 books this year from the Springer publisher. If people want to download these 2 books, you can go to the Springer publisher website to download the e-book. This is my contact. I welcome people to contact me for your interest in focused ultrasound non-invasive surgery. Thank you for your attention.
Thank you, Felix Wong. Next speaker will be Professor Aili from Shanghai, China. She is the professor of Department of OBGY, Chief Physician of Shanghai First Maternity and Infant Hospital, Deputy Head of Haifu Center of Shanghai First Maternity and Infant Hospital. She has more than 20 years of experience in endometriosis and adenomyosis treatment and research, and is highly recognized for her achievement in China. So will you please start, Professor Aili?
Dear friends all over the world, it's my great honor to attend this webinar. My topic is Haifu treatment for adenomyosis and pregnancy outcome. I'm from Shanghai First Maternity and Infant Hospital, Shanghai, China. Shanghai is a beautiful, magnificent, and very international city. Haifu system installed in 29 countries already. The previous speaker, I believe, already have introduced the principle of Haifu treatment. As I summarize here, convert electric energy into acoustic energy through a transducer. So I will not elaborate again. Global Robotic Service Center in all around the world, just like blooming firework. Our journey beginning in 2050. As we always mention, is maybe a coincidence, but once we choose the Haifu journey, we should hold very strong enthusiasm. Accident and coincidence sometimes become an eternity. We gradually increase the cases. Up to now, we already finished more than 2,000 cases. In whole China, we are located in third line. Every year, more than 400 cases. From this picture, we can clearly see our patient focus on myoma and adenomyosis. Especially from 2018, most of patients we treat are adenomyosis. We established a three-step treatment. The first step is Haifu. Second step, we use the traditional medication like GnRH, digesterone, mifepristone. We will, depending on the patient's condition, to choose a suitable medication to control the menstruation, to help hold the size of the uterus, shrink to normal size. Third step, we use Mirena. We published this paper in 2019 for three-step therapy. From this picture, we can see before treatment, here is a very typical posterior adenomyosis. The second picture, picture B, showing 1 day after Haifu, we can see the lesion nearly 90% destroyed, no blood supplement. Just after 18 days, we can see the normal size of uterus. From this picture, we can feel the beauty of the non-invasive Haifu as miracle as a work of art. The normal size of uterus in the pelvic wall is just like beautiful turnip. Haifu procedure usually not very complicated. One doctor from Taiwan, she mentioned, like a very young doctor, just use 2 weeks can learn her whole procedure. The first step is skin preparation. We need a very clean abdomen. This step usually done by nurse. Second step is pelvic MRI evaluation, the specific lesion location and the vascularity of the lesion. This MRI, just like GPS navigation, it's a very important guiding when we're doing the whole procedure. When we find the sensitive area and the correct position, we put the energy on, and we can find the green scale change depending on the real-time assessment. The Haifu technique, the very simple thing is click the mouse, but sometimes click the mouse to need very good luck to appear a white mess, just like snowflakes or popcorn. This is a case we had a very successful ablation. The first second, we saw the grayscale mass. During the procedure, the ultrasound guide will make the important role, just like eyes of the ultrasound. We put the balloon to squeeze out the bowel to put all the procedure safety. The green point here, we will put the area of we feel it's safe and sensitive. The procedure is very simple. So find the correct area and put the energy, then we can see the white color. It's a successful symbol. So after treatment, we will measure the effectiveness. The first symptoms is pain. So from this chart, we can see improve the VS and the VRS score. The second important is menstruation. We can see the reduced menstrual volume score. The third is uterine volume. We can see dramatically reduced month by month. From here, we can see localized and diffusion adenomyosis show significant uterine volume decreased after Haifu treatment. Hemoglobin also can increase after Haifu ablation. Here is a very important biomarker, very traditional marker. CA125 level was compared before and after treatment with Haifu. Localized and diffusion types both can show a very significant decline. The three-step approach combining Haifu, GnRH, or other any kind of medicine can stop the menstruation, cause amenorrhea, and the marina can successfully treat the adenomyosis. It has lower risk of hysterectomy, safe, effective, and efficient. It can improve quality of life, especially for patients with localized adenomyosis. I want to share several successful cases. The first case, the patient, 42, 5 years dysmenorrhea associated with hypomenorrhea. She had a 3 to 6 injection before, also put Marina, but all failed. From this picture, we can see the successful ablation by Haifu. And here showing our step 3. So the second step controlled by medication. The third step, patient will receive DNC and the hysteroscopy. This is the old traditional way, but now we change the style. So also we can see the tissue from uterine cavity. The pathology result is higher grade degeneration. It's also the evidence to exclude out the malignancy tissue. Now we usually to take TCRE, cervical resection of endometrium. This is for the patient without desiration for pregnancy. This video, we can see the resection of anterior endometrium. Second, for posterior endometrium. We usually resect all the endometrium. So here we can see there are no any endometrium inside. It can cause patient without menstruation or just very little, but no pain. For adenomyosis, the final choice usually menstruation or uterus. Second case, the patient is 31, severe dysmenorrhea and menorrhagia for 4 months. We can see the irregular ablation area, but also is belong to the successful case. For adenomyosis, sometimes we should protect the endometrium and the bowel. So we should control the whole dose. The safety is very important. This is the third case. We can see the posterior lesion. And the second picture is 1 day after Haifu, the heart-shaped ablation area. 6 months shrinked, smaller, and 16 months post Haifu, we can see the nearly normal size of uterus. This case patient 22 years, severe dysmenorrhea for 4 years. Adenomyosis always have a long time dysmenorrhea. So this case, we can see the ablation area also very successful. The patient is 29, 1 year of menorrhagia, JNRJ 6 times. So this story mostly are the same. JNRJ, Marina, any kind of traditional medication therapy, all failed without symptom improving. For some patients, Marina will not have any effectiveness. The diagnosis is diffusion uterine leiometasis. This case is 13 years, 4 years of menorrhagia, but this is belong to the myoma, but this picture, we can see the size of the myoma gradually smaller. So I want to share our successful Haifu cases just. The many doctors asking, the Haifu can influence the ovary reserve. The answer is no. Haifu treatment does not affect the ovary reserve. The function will be kept very stable. Pregnancy outcome for adenomyosis, we found several people. Here we can see from 2010 to 2050, 68 MRI confirmed EM patients with fertility desire were treated with Haifu ablation in Suining Central Hospital. This is the biggest hospital in China. Amongst 68 cases of adenomyosis, 67 62 cases were diffuse type and the 6 cases were focal type. The mean age of the patient was 37. BMI is 22. The mean causes of disease was 5 years. And the mean lesion volume was 36. So from here, we can see 54 succeed in pregnancy after Haifu. In 54 patients who had a successful pregnancy, there are no symptomatic uterine rupture or rupture during pregnancy or delivery. Haifu ablation has no obvious adverse effect on normal uterine wall and does not increase the risk of uterine rupture during pregnancy and delivery. So they are not necessary to worry about. Must accept the C-section. Haifu ablation may improve the uterine movement and uterine cavity by ablating lesion, just contributing to fertility. Haifu ablation results in a relief of clinical symptom in adenomyosis patient with fertility desire. No increased incidence of complication during pregnancy or delivery. So we usually use the combined therapy. There are not any single technique or any single medicine can heal the adenomyosis. But now our combination therapy includes the Haifu treatment. After Haifu treatment, we use kind of medication and then TCRE and put Marina. But also can take other technique like robotic or laparoscopic. Also, open surgery had its some advantage when we have some special cases. In our center, pregnancy outcome coming also very well. We had a totally nearly 100 cases from 2050 up to now. Natural pregnancy, 77 cases. IVF, 19. So we have many patients sent in from the other IVF center. About C-section and the normal delivery is depending on the desiration of the gynecology doctor. Some obstetric doctors, they worry about happen uterus rupture after Haifu, but they are not necessarily worry about it. It will not influence the construction of the uterus. This picture, we can see our first Haifu baby born in our hospital. The baby is 28 months, and they checked the MRI just for some, I forgot what's the problem, but not for the myoma. This patient had nearly 4 centimeter myoma, so we can see the myoma shrinks gradually during the pregnancy. This is our first case, but this case, our 1,000th Haifu cases, and she has a normal delivery very successfully. Our 1,000 cases Haifu baby. Usually adenomyosis and the endometriosis, the woman has special personality, full of anxiety, and some patients suffering from depression. So very important thing to do some psychological training. So we also try to learn some IPT training through the psychology doctor. So we create the uterus guiding club to help the patient, and the older patient can sitting together, have some interesting communication. So protect the uterus, we think can protect the dignity of the woman. Also, the patient's character can change. So also can create a very harmony life in the family. My personal journey, I start in the very traditional open surgery nearly 20 years ago. I'm in gynecology already 25 years. And then from 2000, I learned laparoscopic surgery. I learned the primary technique in Melbourne University with Professor Peter Ma in 2004. And in 2008 to 2009, I learned the advanced laparoscopic surgery with Cameron Izzat in Stanford University. Also learned a very primary knowledge about robotic surgery. And also my teacher in China, like Professor Liang Zhiqing, Professor Yao Shuzhong, Professor Chen Jie. The three teachers are my laparoscopic supervisor. Then from 2015, I accept the Haifu technique. So I thank all my teacher in my learning journey. Also my laparoscopic very important supervisor from Melbourne, Sydney, Professor Felix Huang. Up to now, he always give me the encouragement to develop Haifu. This is our team. And in summary, Haifu has the advantage of non-invasiveness, lower complication, quick recovery, and the retreat capability. Haifu can selectively ablate the concentrated granular muscular lesion, reduce the scope of the lesion, and abrogate the functional ectopic endometrium, so as to improve the symptoms such as dysmenorrhea, the most important symptom the patient we are facing, heavy menstruation, the second symptom we should to deal with, and the uterine environment. The very important thing is uterine environment, because some patients had the pregnancy desiretions, they always facing the abortion or the IVF several time failure. So change the environment is very important. We have many patients larger than 40. They wouldn't like have a second baby, or they have no any desiration to pregnant again. But after Haifu treatment, they pregnant several times. So it's not a good result. The patient said the side effect of Haifu is to be easily pregnant. For women with pregnancy desire, Haifu also has a treatment intent of improving probability of successful pregnancy and delivery. So thank you very much. Welcome in the future after pandemic gone, to come to China. All the best for all of you all around the world. Thank you very much.
政客而性质 will still in Shanghai 2025 effect will be Shanghai. The next speaker is from Spain. I have heard you speak 2 weeks ago, but it's very touching to know that you're very few doctors who know about Haifu. You have asked EUD seminars and nobody talks about Haifu. The next because the Jody Gonzalez. Since 2000, I'm kind of member of the functional gynecology oncology unit. A member of the unit at the University Hospital. It has told you the field came out you don't know. We're not protected using ultrasound guide Haifu. I'm glad you have used ultrasound guide Haifu and not 这 MRI 的还付，至少头发就是那不要这EIT working on non surgical breast heavy of not disease. This is in your breast, the target for gynae adjustment. Personally, explained by the weak causes and conquers in gynae adjustment and ultrasound therapy. I hope you speak at the next as EUD and you bring meeting. Over to Dr. Jody Gonzalez.
Thank you very much for your kind invitation to this important congress to speak about the Haifu technique applied to uterine fibroids and pregnancy outcomes. I'm Dr. Rodriguez, the head of Haifu unit of Mutua de Terrassa Hospital in Barcelona, Spain. And okay, come on. The first thing I want to point out about the uterine fibroids, apart from the fact that they are very prevalent and cause significant morbidity in women, is that there is enough evidence about their negative impact on fertility. And this infertility associated with fibroids occurs by different mechanisms that have been described by some authors, such as anatomic distortion of the uterine cavity, and increased uterine contractility, impairment of the endometrial and myometrial blood supply, and hormonal changes induced by fibroids. And on the other hand, we must also take into account the age factor because, as you know, the age remains the single most important determinant of human fertility. Currently, there is a tendency to delay childbearing beyond the age of 32 years, mainly in Western countries. And this situation, combined with the increase of fibroids with age, leads us to a new scenario, which is the large number of older patients with fibroids and problems conceiving. And the advances in new reproductive technologies cannot compensate for this issue. And this is a very serious problem. The effect on fertility impairment depends on the location of the fibroid. As you know, there is evidence that patients with submucosal myomas and intramural myomas distorting the uterine cavity have the most significant impact. On the other hand, some authors support the idea that intramural fibroids greater than 4 centimeters, even without cavity distortion, may also negatively influence fertility. In fact, there are many studies focused on association between this type of fibroids and in vitro fertilization outcomes. And in this line, some publications like this systematic review and meta-analysis conclude that this type of fibroids, even small size, over 2 centimeters, really impact adversely on IF outcomes. However, it also concludes that there is still no definite evidence to indicate routine myomectomy in these cases. We strongly believe that Haifu therapy, but its non-invasive nature, could be a good treatment option for these patients. But it's something that we have yet to demonstrate with prospective randomized studies. Right, on the other hand, when women get pregnant despite the uterine fibroid, they are subject to a specific pregnancy complications such as premature delivery, placental abruption, placenta previa, and abnormal fetal position and other complications. In terms of treatment, there is currently a large arsenal of available treatments, from classical excisional procedures to occlusive procedures, and of course, ablative procedures such as radiofrequency ablation, here on the right, and of course, high-intensity focused ultrasound. Even though so much variety of treatments, nowadays, the myomectomy is still considered the gold standard for women with symptomatic fibroids who wish to become pregnant. Surgery to remove fibroids seems to improve fertility, especially in submucosal fibroids. Anyway, if you look at the literature, one wonders if that is really true. I'm sorry, but this Cochrane review of 2020 concludes that there is no evidence for a significant effect on the clinical pregnancy rate after myomectomy of an intramural or submucosal fibroid. And this is not my opinion, it's published evidence. Nevertheless, there's enough evidence about complications associated with myomectomy, hemorrhage and blood transfusion, organ injury. It can cause pelvic adhesions that may increase the risk of infertility and cause a uterine scar, delaying the time of gestation and increasing the risk of uterine rupture. Okay, what can Haifu offer to these patients? Surely many of you already know that Haifu is an emerging and non-invasive technique for the conservative treatment of solid tumors. But you know, in 2002, one reported that ultrasound guide Haifu was safe and effective in treating uterine fibroids. In 2004, FDA approved the treatment for uterine fibroids. And in 2019, the National Institute for Health and Care Excellence approved Haifu technique and published a medical guidance on ultrasound guide Haifu with evidence-based recommendations. In the same year, ESG Working Group on Surgical Ablative Therapy of Benign Uterine Disease was created, of which our Haifu unit played an active role. According to the Focus Ultrasound Foundation, right now over 128,000 women with uterine fibroids have been treated throughout the world with great success. In respect of the therapeutic principles, the ultrasound waves are delivered by therapeutic transducer, and they travel safely through adjacent tissues to reach deep into the focal spot. Suddenly, a small area of selected tissue is heated between 70 to 90 degrees and is destroyed. Focal spot is guided by real-time ultrasound imaging. Okay, the safety of the treatment is based on its great precision to treat tumors. This is supported by several studies of pathological anatomy that demonstrate a coagulative necrosis with clear and sharp boundary between treated region and untreated region here on the top, okay? And this is the result. On the left, you can see the images before sonication. Here, ultrasound image. Here, ultrasound with contrast and magnetic resonance with contrast. And on the right, images after treatment that show hyperechogenic changes on the top, okay, and a non-perfused volume of 100% on contrast-enhanced ultrasound and contrast-enhanced MRI here. Okay, in relation to fertility, Haifu safely and effectively achieved ablation of uterine fibroids without damaging the surrounding myometrium, which conserves its biomechanical properties of tension and contractility. Haifu also preserves ovarian and endometrial function. We have some studies that show no significant difference between the anti-Mullerian hormonal levels before and after treatment, with no amenorrhea patients after the procedure, and with no symptoms suggestive of menopause after treatment. In this other retrospective study from the last year, Melkozerova et al. Observed no significant changes in molecular and tissue markers of endometrial receptivity in women undergoing Haifu ablation for uterine fibroids. More and more evidence day by day. And the objectives of Haifu ablation of uterine fibroids in women with gestational desire are on the one hand, to achieve the inactivation of the hormonal and vascular function of fibroids, and on the other hand, to shrink them in order to normalize the uterine anatomy. Both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery. Okay, we already have several publications with good pregnancy outcomes after Haifu treatment. Large series of 100 and up to 130 pregnancies after Haifu with high gestation rates. The conclusions of all the authors are the same. Full-term pregnancies with a normal delivery and without complications are possible after Haifu. And in these cases, there are patients or cases of uterine rupture or abnormal placentation. Well, I'm going briefly to talk about our experience with the Haifu technique and the pregnancy outcomes. And I take this opportunity to congratulate my team at the Mutua Terrassa Haifu unit in Barcelona for the recent publication of our work. In our retrospective study, we include 560 women with symptomatic uterine fibroids, okay, who underwent ultrasound guide Haifu between February of 2008 and February 2018. 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancies after Haifu treatment in a Western country. The pregnancy rate was 34%. And among the 71 pregnancies, there were 43 successful deliveries, 20, including a natural twin gestation, okay, 22 first trimester spontaneous abortions, and 6 therapeutic abortions for personal reasons. As you can see in this table, the incidence of cesarean section in our series was 43%, okay, which was much lower than in patients undergoing myomectomy or uterine artery embolization, or in those reported by other authors after ultrasound guide Haifu. Regarding the characteristics of 43 successful deliveries achieved after Haifu, the rate of full-term deliveries was 91%. Therefore, the rate of preterm delivery was 9%, only 4 cases, which is lower than in series of pregnancies with untreated fibroids or pregnancies following uterine artery embolization. The mean birth weight of the 44 newborns was 3 kilograms. 7 of them were low birth weight infants, these that you can see here, okay? Except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction, the remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. The complications detected during pregnancy in our series were 1 case of first trimester bleeding, 1 preterm labor, 1 renal colic caused by growth of the myoma, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes. In the intrapartum and postpartum complications reported include 3 retained placenta here, okay, with manual removal, 1 of which received a red blood cell transfusion, 1 case of severe preeclampsia that ended in a forceps-assisted delivery at 37 weeks, and 2 cases of emergency cesarean section, 1 case for fetal bradycardia and the other for hemorrhage associated with placenta previa, okay, with no consequences for the fetuses. It should be noted that this series had no cases of uterine rupture or placenta accreta, which can occur after myomectomy or UAE. Regarding the clinical outcomes of the treatment in the 55 women who became pregnant, Haifu ablation was followed by substantial shrinkage of the ablated fibroids with significant symptom improvement. Okay, we must highlight that these results were achieved in women with a medium maximum diameter of treated fibroids of 6.4 centimeters, okay, and a non-perfused volume ratio of 76%, which is higher than that reported in most series of Haifu treatment. Only 5 minor complications were observed. In 1 patient, the 10-centimeter fibroid treated was almost completely expelled from the vagina 6 months after Haifu ablation. Another patient had vaginal discharge of the treated fibroid 2 months after Haifu. 1 patient had a first-degree skin burn, and 2 patients had self-limited hematuria. No major complications such as bowel or bladder injury or nerve damage occur, and no patients develop amenorrhea after Haifu ablation. Okay, then I'm going to present some interesting cases. This is a 30-year-old woman with a previous premature labor with hypermenorrhea, anemia, and secondary sterility. As you can see, she had a transmural fibroid of 10 centimeters. It is hypointense here, okay, and has a low vascularization. Both are very good characteristics to Haifu, okay, and we achieve a complete ablation of the fibroid. In this image, you can see the great non-perfused volume. 100% of the fibroid was ablated. MRI 6 months later showed a reduction in the size of the fibroid to 2 centimeters. Just then, the patient underwent a hysteroscopic resection for the remaining myoma fragment. And this is the hysteroscopic video after Haifu and surgery showing a normal uterine cavity. The woman became pregnant spontaneously 3 months later and gave birth to a healthy baby weighing 3.5 kilograms. This is another patient, a 33-year-old nulliparous woman with hypointense submucosal fibroid of 6 centimeters and hypermenorrhea. You can see in this image the myoma occupying the whole uterine cavity, okay, with vascularization, with high vascularization, and in small areas of low vascularization. Contrast-enhanced image immediately after Haifu here showed a non-perfused volume of 100%, the whole fibroid. 6 months later, the myoma completely disappeared with restoration of normal uterine anatomy. This patient achieved 2 full-term spontaneous pregnancies that ended in uncomplicated vaginal deliveries at 38 and 37 weeks. Okay, as a conclusion, so message to take home, uterine fibroids can negatively affect fertility and increase the risk of specific pregnancy complications. And myomectomy has some disadvantages that we should consider, as I said before, especially in women who have desire to conceive. According to our experience, ultrasound guide Haifu therapy is an effective and safe treatment for uterine fibroids. Ultrasound guide Haifu makes it possible to obtain full-term pregnancies with few intrapartum or postpartum complications in patients with benign uterine pathology, fibroids or adenomyosis. And due to its non-invasive nature, Haifu should be the first therapeutic option in women with uterine fibroids and gestational desire, with many advantages over myomectomy and uterine artery embolization. And of course, we need prospective randomized studies to confirm these observations. And that's it. Thank you very much for your attention. I leave my email address in case you have any questions. Right now, I hope to visit you in the future, but in person, and do enjoy a country as wonderful as Japan. Okay, that's right. Thank you very much. Bye-bye.
Thank you for your talk. So I'd like to invite the next speaker, Dr. Selva Subramanian. He's a consultant obstetrician gynecologist and subspecialist in reproductive medicine at the private hospital in Melaka, Malaysia. He heads the OBGY unit and the IVF center at the hospital. Dr. Selva first started laparoscopic surgery with Chiron Lee, and he past president of APAGE and Obstetrician Gynecologist Society of Malaysia. And today's talk, surgery video of Haifu treatment for uterine fibroid and adenomyosis. Please start, Dr. Selva.
Hello, my name is Dr. Selva. I'm a consultant obstetrician and gynecologist at Mahkota Medical Center, Malacca, Malaysia. In this video, I'll first explain the procedures before we perform Haifu for fibroid and adenomyosis. Patients with fibroids and adenomyosis usually learn about Haifu from their doctors, social media, or from newspaper. They will call us for more information. We usually tell them that there are two options. Number one, to make an appointment to see me for consultation. We usually arrange for a consultation early in the morning. After the consultation, an ultrasound will be done. After that, we will arrange for an MRI to be done. After reviewing the MRI, we will then do a simulation on the Haifu machine to see whether Haifu can be done. Once simulation is done, then we will arrange for the Haifu surgery. We will then fill up the necessary forms for insurance claim and fix a date for the procedure. Some patients who do not want to travel to Malacca for a consultation will do the MRI in their own hospital. The MRI will then be sent to us for evaluation. If they are suitable for Haifu, we will arrange for an appointment for simulation and Haifu surgery. Preparation for Haifu starts 4 days before the surgery. For 2 days, patients are asked to be on a low fiber diet. After that, for 2 days, they have to be on liquid diet. This is to ensure that there are no fiber in the intestines before the surgery. This is very important. The patient is seen in my clinic the day before the surgery. She will be admitted. On the night before the surgery, she will be given 2 bottles of laxatives to drink to clean the bowel. She will be fasted from 10 p.m. On the day of the surgery, she will be given an enema. An intravenous drip will be set up and we will place a urinary catheter. She will be brought to the Haifu center and will be placed on the machine. Mild intravenous sedation will be given. Then we will perform the Haifu surgery. The patient will be awake throughout the surgery. After the surgery, she will be rested in the prone position for 2 to 6 hours. She will be able to have light refreshments after about 2 hours. She will be discharged the next day. Fibroids and adenomyosis are common diseases in women. Fibroid is a benign growth of the muscle of the uterus. Adenomyosis is a condition in which the inner lining of the uterus breaks through the muscle wall of the uterus. Currently, the treatment available for fibroids and adenomyosis are surgical removal of the fibroid or adenomyosis or complete removal of the uterus. Hi, I'm Dr. Selva, consultant obstetrician and gynecologist of Mahkota Medical Center, Malacca. Let me share with you an overview of high-intensity focused ultrasound or Haifu. To perform Haifu, the preparation starts 4 days before the surgery. The patient must be on a low residue diet for 2 days, followed by a liquid diet for the next 2 days. She will be given an enema 12 hours for bowel preparation before the surgery. She must fast for 8 to 12 hours before the procedure. On the day of the surgery, the patient will be brought to the Haifu center. Her abdomen and perineum will be shaved and cleaned. A catheter will be placed in her bladder. An IV drip will be set up. The procedure is performed under a light sedation. She will lie face down on the machine. The doctor will then plan the surgery. The surgery will take about 1 to 2 hours to complete. Haifu is a technique whereby an ultrasound beam is brought to a tight focus in the fibroid and adenomyosis, heating up the tissue within and destroying the diseased tissue without causing any harm to the surrounding tissues. Mahkota Medical Center will be the first hospital in Malaysia to introduce the ultrasound-based Haifu. There are many advantages of Haifu. It is a non-invasive therapy. There is no scar in the abdomen. The patient will not experience any blood loss and there will not be any blood transfusion. The patient can communicate with the doctor at the time while the procedure is being done. It is not done under anesthesia. It is only done under light sedation. The patient will only experience minimal discomfort after the procedure. She can return home when the sedation is worn off after about 6 to 8 hours. In conclusion, Haifu provides women with a good option to preserve fertility and the ability to quickly return to normal activities after treatment. In this video, I will describe how Haifu is performed for fibroids and how we assess whether the Haifu surgery is successful. My patient is a 32-year-old lady with a 7 by 6 centimeter fibroid. This fibroid causes pressure symptoms for her. Ultrasound showed a large fibroid measuring 6.76 times 7.16 centimeter. There was another smaller fundal fibroid measuring 1.65 times 1.74 centimeters. MRI was performed in another hospital and it was not very clear. This is the T2W1 sagittal MRI showing the dark uterine fibroid. This is a contrast sagittal MRI showing that the fibroid is vascular. She underwent Haifu surgery. We decided that we will not ablate the smaller fibroid because it is too small and close to the endometrial cavity, and there is a risk of damage to the endometrium if we ablate it. Microbubble sonoview was injected before the surgery. You can see the blood flow in the fibroid. The fibroid was very vascular. This is the complete video of the Haifu ablation running at 20 times the speed. The whole surgery took 48 minutes. The whitish areas that you see are the grayscale changes caused by the Haifu ablation. We start the ablation at the largest slice. The focal point is moved from one point to another until sufficient energy is given to each slice. Once sufficient energy is given to one slice, then we move to the next slice. There are several precautions that need to be taken when ablation is done. Firstly, the energy must not reach the serosa of the fibroid, and so a safety margin of about 15 millimeters is given all around the fibroid. Secondly, we must ensure that the bowel is away from the path of the ablation. This is the position of the bowel. Once sufficient energy is given to all the layers, then color Doppler is done to see whether the ablation is complete. At the end of the surgery, microbubble sonoview is then injected to see whether the ablation is sufficient. The dark areas that is seen are the areas that has been ablated, indicating that there is no blood flow in these areas. The probe is then rotated so that the fibroid can be seen in the transverse view. The dark areas are the ablated areas of the fibroid. Microbubble sonoview is a good way of determining whether the fibroid has been completely ablated. The next day, she had another MRI. Contrast sagittal MRI shows that the fibroid has been ablated with dark areas which are the non-perfused areas, NPV. About 90% of the fibroid has been ablated. I will be following her up and I will be doing regular 3D ultrasound scans to measure the size and volume of the fibroid. After 3 months, I will be performing another MRI to see the amount of shrinkage of the fibroid. Thank you for watching this video. I hope you have a good idea as to how Haifu is performed to ablate and shrink fibroids. This is a non-invasive method of shrinking fibroids without surgery.
So thank you for your beautiful video, Superman. So now, is there any question from anyone? So I would first ask Dr. Selva for if the patient gets pregnant after Haifu, how do you think of the type of delivery? Former speaker suggested vaginal delivery is possible, but how do you think of it?
Thank you, Dr. Tsutsumi.
Yes, yes.
I mean, I'm still very new to Haifu. I just started 2 months ago, actually.
Yes.
2 months ago, exactly 2 months today. But we've already done 37 cases. So I'm having a good feeling about this procedure. My feeling is that if the fibroid reduces well, and the patient conceives, I think if there's no contraindication, I would be very happy to allow her to go into normal delivery. I mean, I've been doing IVF and laparoscopic surgery for about 30 years now. And when we do laparoscopic surgery, we are always very worried. And so we tend to do, because they are mostly a lot of them are infertility patients, we tend to do a cesarean section for them. But for Haifu, I'm more confident because we are not cutting the uterine cavity. So I think I'll be very comfortable to allow her to go into normal delivery. And I, after listening to all the other speakers, my confidence is increased. So I'll probably allow her to go into normal delivery.
Thank you. If there is not any question, maybe QED will give his closing remark, I think.
Thank you. I think we have heard from the speakers, most of them started with oversurgery, then MIS. I think now everybody should know about Haifu, even if we do not do Haifu. I would like to emphasize, even if you do not do the fibroid, Haifu can stop the growth of fibroids and adenomyosis. Everybody's talking about some case. I think before some case, we must stop the growth of the fibroid. And I would like to encourage young doctors to learn or read about Haifu. I also think that Haifu should be included in the standard Chinese textbook in the future. I think all of us always think of children are adenomyosis, children of fibroid growth. To the future, children are not part classification of fibroids are not important. Important is how do we solve the problem of our patients. We have a lot of children but we are not solved the problem.
I'm sorry to interrupt you. Chiron will give a few words maybe.
Yes.
Before the closing. Yes.
Okay.
Will you please give some words, Chiron?
Thank you. Thank you, Kiwai. Is under recovery, but he is still work very hard in Haifu and all the APAGE. We want to send thank you to the Kiwai Lee. And more, the goal of Haifu to the patients is to the better life, better quality of life. Secondly, to the doctors, they can let the doctor catch the trend, from the open to minimally invasive to non-invasive surgery. That should be the trend in the future, so the doctor can catch the trend. So everyone get advances in the technique. So for the society can have a lower down the cost effectiveness. So I think the Haifu is a very wonderful technique. And so that is the reason why the fungible include the liquid wine, Tsutsumi, and also the Phyllis Wang and the Silver Vinyl. they are all work on the Haifu. So we also set up the Haifu committee. In the Haifu committee, the Dr. Li Qi have do a lot of work and do every effort in the establish the training center and training the newcomers. So I think that is a very great contribution to the Haifu and also to the society. So we want to say, I want to express our gratitude to the Dr. Li Qi, and also we want to encourage all of you to join us, the training center. Now the training center, there are so many training centers in China already, and they have new training center in Hong Kong, in Singapore, and later on I think will be in Japan, the Professor Susumi-sai. And so I think that will be very good. Before service to the patient, we get good training, and to let the doctor have a good training place, the training center have a standardization is necessary. So the Dr. Li Qi always working on the training center standardizations and also the standardization of the surgeon. We want to express our gratitude to the Qi Li and also the first one and also the Chongqing Haifu. They do a lot of the work and do a lot of the academic contribution to the Haifu. I think that is a great contribution to the medical and also all the surgeons and also the gynecology and also all the doctors. So here I want to express the thank you for all the committee member and also both of you in the chairing this sections and all the speaker, the include from the Spain and from the England and the Ai Xinzi and also the Silvers and every one of you. Thank you very much. Thank you.
Thank you.